Hi, I'm Rachel Levine, Integrative Homeopath, and today we're going to talk about homeopathic medicine and cancer. Most people I've treated in my practice with cancer came to see me as a last resort. Mostly when the doctor said to them, "I'm sorry, there's nothing more that we can do for you." That's when they came to me. And we got great work done together and their lives extended. But today I get to talk to Gabriella, who was diagnosed with metastatic melanoma in the fall of 2023. And Gabriella chose to start using homeopathic medicine, not as a last resort, but right at the start of her diagnosis. She also happens to be my incredibly courageous and strong wife. So of course, I am thrilled to be able to do this interview with her today, a year and a half later. Hi, Gabriella.
Hi.
Just to start, can you take us back to the moment that you received your diagnosis? What were some of your initial thoughts and emotions?
Hi, everybody. Happy to be here. So I think that I want to maybe go back a little bit further when in 2017, I had a mole and it turned out to be melanoma, and it was on my left shoulder. It was removed, and it was at the time all the testing was done, and it was a 0.01 chance of spreading. Then about what it's like 6 or 7 years later, I wake up one morning with a huge lump under my left in my left armpit. And, it's like, that's a shock because 2 months prior, I had a mammogram, and I don't, I don't avoid touching that area. And so it was sudden. It was a weird thing. It was shocking. And so the process of finally diagnosing it as a stage 4 melanoma, that process was long. It took about a month and a half, and it was very confusing and scary, and produces a lot of anxiety. So for all people out there who are experiencing that preliminary stage, I understand that it feels really, really scary. So, and I had a couple of biopsies, and the biopsies were incredibly painful. So I was having a lot of pain, a lot of anxiety. And then when finally, we walked into the oncologist office to get the final diagnosis, I think I felt a little bit of relief, because now we will have like a way of moving forward. And the difference of moving forward today or 10 years ago is that today immunotherapy is the standard for treating melanoma. And 10, 15 years ago, it wasn't. So, so I was put on a trial, and that trial had a very heavy, it was a lot of drugs. It was 3 immunotherapy drugs plus a suppressant for the side effects. And, maybe Rachel can talk a little bit about what immunotherapy is, but my state of mind was finally at the diagnosis was like, I am going to do everything I can to survive this, and survive it the best way I can. And luckily, I have an amazing wife who does incredible amount of research and she doesn't let anything slip. And so we immediately looked for an homeopath that could treat me, because you, Rachel, this thought that it wouldn't be the right thing to treat me. So we found a great homeopath, and we started the treatment right away. So in fact, I would say that the first dose of immunotherapy was given around the same time as the first doses of the remedies.
So immunotherapy, different than chemotherapy, immunotherapy works systemically and starts stimulating the immune system to work with the cancer. So it's a systemic approach that it's a very interesting form of treatment. So yes, I decided it wouldn't be professional for me to be Gabriella's primary practitioner. So we started with my mentor, Dr. Andre Sain, who I started my practice under in Montreal 17 years ago. And we were very fortunate to get into his, to start working with him, because he has a 2-year wait list. So you mentioned that as soon as you started taking your remedy, using a classical homeopathic approach, so really looking at the underlying root of Gabriella's case, looking at the presenting picture. So yes, taking into consideration the melanoma, the metastases, but also the entire picture of what compromises her other physical symptoms, her mental, emotional symptoms. So everything, to really create the best remedy that she needed in this moment. Now, you said that you started feeling an immediate response when you started taking your remedy. Now, were you expecting an immediate response, or were you expecting something to be more gradual? Were you expecting to feel anything? What were your experiences, and what were some of your expectations?
Well, I mean, my expectations were to heal, to be strong again. But at the time, I was in a lot of pain. So the pressure of the tumor on my nerves, towards my chest and towards my arm, were so severe that I could not move at all, and it would cause pain. And so I was ready to start treatments. And I would say that when I started the homeopathic, taking the homeopathic doses, it created an aggravation. And that was scary at that time, because I was already in so much pain that I didn't want to have more pain, right? So I was scared, but I would ask you, so is it going to be okay? I mean, this is I had really clear signs of an aggravation, and you explained what an aggravation is and what would happen. And then 5 or 7 days later, I began to feel really well. Like, it's not that I had no pain, but my energy, my life force was stronger. And that was a clear evidence for me that there's this thing. And so that's what I felt.
I should say that sometimes, an aggravation isn't that it's not like side effects to a medication, that something's, hurting the body. What happens is that anything that's been suppressed in the body over a period of time comes up and then subsides, and then the person starts to feel really good. And Gabriella, the remedy she needed to start this process when looking at her case was really a remedy she had needed for a long period of time. And so her symptoms came up, they heightened, And like she just said, they went down and she started to feel really good, her vitality. And when we start seeing the vitality, the energy, that is the clearest sign on a systemic level that the remedy is moving the person. Okay, excellent. So what were some of, when people talk about cancer, they have many ideas about why someone got cancer, and what were some of the emotional challenges you faced when you got diagnosed and throughout your journey that you had to navigate for yourself?
Yeah. Well, definitely when you get a diagnosis such as cancer, you hear a lot of commentary around you brought it upon yourself. Is you who is, there's a weakness somewhere in you. There's an element of that you still have to work on. That's why you got cancer. For me personally, I had to work with some of those thoughts that were creeping in because they were there. They were strong. I also come from a family that has experienced loss from cancers. So it is not uncommon in my experience to have this experience. But one of the things that I felt very strongly about was to work on forgiveness, forgiving myself for things that I was carrying for a long time that were holding me, somehow they were holding me in a place that was full of sorrow, full of pain. So I did some wonderful healing work with a therapist, that forgiveness therapist, that really released some of these old stories. And I also, during that process, and maybe in a spiritual level, I was able to call in some of the people who I felt that are dear to me, that I could ask for support. And so that was also meaningful to me. Look for, call in those angels to help me in this process, and not to be alone. I wasn't alone. Luckily, you, Rachel, were with me every step of the way. But on a spiritual level, I felt that was very important, to call in those angels.
So during the first, I would say 6 months, Gabriella did not miss a beat. She, was doing her immunotherapy infusions once a month. She was on another medication, and she was using homeopathics consistently. The remedy that she needed, we started at a mid-range potency, and it continued to go up to potencies that most people who've used homeopathy have never heard of. And she continued to, her energy. No one would have known the state and the stage of cancer she had, because her vitality was so good. But there was a moment when the trial drug ended, and you started experiencing horrible side effects. And can you just explain a few of those side effects, and how homeopathy helped you with those side effects?
Yeah, as you said, the moment the drug that was suppressing the side effect was that trial was over, I began to experience severe colitis, so severe that I was hospitalized, and then was given a medicine, a steroid, that to suppress the colitis. That did not help whatsoever. In fact, I think it probably aggravated me, and it aggravated me in many levels, but I couldn't just stop because that is, I was given a very high dose, so I had to taper down. But that process led to other side effects. I just want to, respond to your question, which is homeopathy was the only thing that was helping. I mean, it was like the symptoms. I would immediately contact you, of course, you and the homeopath to report the symptoms. And it was every 2 days. It was I was acute, and it was an incredible benefit for me because it was a very successful way of treating my side effects.
Can I just jump in there for a second? Sorry. Before we move on to the other side effects, I just want to talk about the colitis itself, because that was the first major side effect that you had to immunotherapy. And so unlike chemotherapy, where a lot of the side effects are one loses their hair, the extreme fatigue, immunotherapy really targets the gut. And so colitis was to be expected on some level with immunotherapy. And what Gabriella was presenting was severe colitis, which also, of course, then leads to dehydration. And because immunotherapy is so new, as practitioners, we go to what we would use perhaps for chemotherapy, remedies that have been successful for chemotherapy. So it took a little bit of a dance, I would say, right, Gabriella, to really get that right remedy. And when we did natrum sulfuricum for immunotherapy and colitis, that colitis stopped. And then now she'll explain some of the secondary side effects that she had to immunotherapy.
Right. It was a miracle, actually. It took a little bit of time to find the right remedy, but when I took it, it really took care of those symptoms. But what happened was that I was given prednisone and at the hospital, and there was a very large amount, and there was a desire for me to taper it. Anyway, basically that led me to have severe pericarditis, which is a 1 percentile side effect. And it means that there is fluid around the heart. So there's a sac around the heart, and that was filled with fluid. And the pain is out of this world. And it mostly was, up neck and shoulders, and pressure on the chest, and shortness of breath, and then my blood pressure would go dangerously low. So I was again admitted into the hospital several times, gone to ICU, misdiagnosed, and finally diagnosed correctly, and given I had to do a procedure to remove the fluid. But when you're in that machinery of hospitals and doctors and so forth, it is really important for you to have somebody who is your advocate. Rachel was my advocate, and she was amazing. But it is so easy to enter in that medical cycle where you're giving drugs and more drugs and more drugs, and then there's the consequences of taking those. So I was basically saved by Rachel because I would not have had the state of mind to even think and do the research necessary. So, but then homeopathy really provided the when the symptoms would resurface, I would take remedies that will decrease the symptoms, and that really, really helped, even with all the other drugs I was taking.
So with homeopathic practice, just as a side note, she's continuing, throughout the period, taking the remedy she really needed on a deeper level that she needed for a long time. And then you have to navigate the side effects to the treatments. And so it's definitely a dance. So any practitioner that's listening, you really want to be able to decipher what is that natural picture and what are the side effects, and treat accordingly. So it was, definitely, we had this great experience where these inflammatory symptoms would come on, we would treat them, and the symptoms would reduce. And that prevented as she was healing from the pericarditis, it prevented us from having to go back into the hospital more times. So maybe you can share where you're at now on your journey, and what would you say to someone newly diagnosed stage 4, stage 1, who they're scared and they're considering using a modality like homeopathic medicine?
Well, I'm in remission now, so that's very good news for me and for our household. And I would say that I wouldn't be where I am today without homeopathy. Perhaps I would, the cancer would have, taken a turn for the worse, or perhaps it would have been a journey that would be, maybe I would be without cancer, but with an incredible amount of damage to the body. So I believe in homeopathy because of I have experienced it on a very challenging illness, and it has done miracles for me. It reduced the side effects. It increased my vitality. It just the sense of well-being that I feel now, I attribute to homeopathy. So I would highly recommend it for anybody who's diagnosed with any illness, but especially when you are entering into the machinery that is the medical system.
And just to finish up, is there any other, words of advice or thoughts that you want to share with anyone listening around cancer, your journey, complementary care, anything that you'd like to wrap up with?
We all hear, you're different after cancer, and you are different. It is a process that takes a huge toll on your body and your mind and your spirit. So be kind to yourself. Take your time to heal, and allow yourself to the pause. I think that for myself, I didn't miss a beat, and then when that was done, then I took the pause. And so that was my way. Whatever way fits right for you, know that it is a big toll on you and the people around you. And it's okay. It's okay to be slow. It's okay to not know what to do. You just have to do your best. And I am way more appreciative of my life. That I can say.
Excellent. Well, of course, I'm thrilled to do this interview because we have such a great success, and it's my wife, and I'm so blessed. Yeah. And it's kind of the best gift ever. So thanks, Gabriella, for being vulnerable and feeling okay having this conversation to share.
Thank you.